Good morning, everyone. Thank you so much for attending today. We are so excited to welcome you all to the 4th Annual Virginia Behavioral Health Summit hosted by the Virginia Healthcare Hospital and Healthcare Association. The VHHA is a member-led association representing hospital and health systems throughout Virginia. Our president and CEO is Sean Connaughton, and our board chairman is Steve Arner, president and CEO of Carilion Medical Center. As you'll see, I'll be kind of looking back and forth between some things that have been written here, and so please bear with me through the introductions. But again, just so excited for everyone to be with us today, and this incredibly pivotal and important time in Virginia for healthcare and behavioral health. So thank you for your participation and engagement. We look forward to some great content, some information sharing, some conversations. So my name is Kurt Hooks. I'm the CEO at Virginia Beach Psychiatric Center. I also have the privilege of chairing the VHHA Behavioral Health Committee. And we, again, are so excited that you have joined us this year virtually, of course, which most things have necessarily been for the Behavioral Health Summit. As you know, today's theme is coming out of isolation, our next normal. I would like to take a moment to thank our generous sponsors whose contributions have allowed us to hold this event at no cost to the attendees. So thank you to Centera Healthcare, a neighbor of ours specifically at Virginia Beach Psych Center, the Children's Hospital of the King's Daughters, also a nearby neighbor, and of course, Universal Health Services for all being gold sponsors. And our silver sponsors include the Medical Society of Virginia, thank you, Good Neighbor, and Molina Healthcare. So thank you to our gold and silver sponsors. And to the bronze sponsors, we have HCA Healthcare, Innova, the Virginia Academy of Physician Assistants, the Virginia Rural Health Association, and the Virginia Association of Community-Based Providers. So thank you all sponsors so much for allowing this event to be in largest scope and supported throughout the states and the Commonwealth. So as a Commonwealth and a nation, we have been tested in unimaginable ways in the last 18 months in particular. It is important that we look towards the future and the day that COVID-19 pandemic is behind us. Although we have hoped for that in many phases, we certainly look forward to getting beyond that. What that looks like is still, obviously, there's a lot of uncertainty, and that is going to be kind of some of the focus of what we'll be discussing today throughout the day. But again, we do look forward to that day when this is not in the front, back, in middle of our minds at all times in terms of what we're trying to accomplish. Unfortunately, we are not quite there yet. So the COVID cases, as you know, they continue to rise. I know we have a variety of stakeholders represented here, many operators for various systems. Everyone has been impacted in some way. The healthcare workers continue to be on the front lines, caring for Virginia's most vulnerable individuals, and families continue to experience loss. And we deeply appreciate the efforts individually, facility-based, collectively, holistically throughout the system of care, and just remaining focused on the mission to take care of our citizens here in the Commonwealth. Despite the devastating impact of the pandemic, we must thoughtfully plan for the future. This while taking the time to learn from the lessons of the last 18 months. And that is our goal for today's summit, to begin the process of understanding the true impact of COVID-19, especially as it relates to behavioral health, and to build the knowledge and experiences of others in the field. Virginia, like many other states across the nation, is dealing with an unprecedented increase in behavioral health needs. So as our resources have diminished, the needs paradoxically have increased. The consequences of the pandemic, including isolation, unemployment, and tragically loss of life have negatively affected many people's behavioral health. According to the Kaiser Family Foundation, 4 out of 10 adults in the US have reported symptoms of anxiety, depressive disorder, an increase from 1 in 10 prior to the pandemic. And that does not include, of course, the issues with substance use disorders, which have dramatically escalated as well. Stress over the pandemic has resulted in other negative impacts, such as increase in alcohol consumption, substance use, you name it. There's not been one thing that has been untouched by the reality of this pandemic. The well-being of our children is especially concerning with the school closures last year, isolation from friends, and home stressors, a lot of adjustments and readjustments. During the pandemic, parents with children ages 5 to 12 reported that their children showed increased symptoms for depression, anxiety, and psychological stress. Those of you out there who are parents, I'm sure that you can identify with this and attest to it in your personal and professional experience as well. While private insurance data has revealed that the mental health related claims for adolescents ages 13 to 18 have increased sharply compared to all healthcare claims. And we expect that trend across all domains of behavioral health to continue to rise. So now is a time for us to come together to figure out a way to meet the needs effectively of our community members struggling. While behavioral health services and supports are needed more than ever, the workforce shortage, a very probably preeminent critical element, has resulted in the closure of many needed services. And again, I think all of us can relate to this in different ways, on the consumer end, on the provider end, everything in between. This has been an existential problem for us. Virginia is at a crossroads. We have reached a very critical time in our Commonwealth and a critical time for our behavioral health system. Moving beyond the pandemic and its impacts, which will be felt for years to come, we will require innovative ideas, financial investment, and each of you, most importantly. We no longer have the luxury of working within our silos. We most identify opportunities for collaboration and partnership in many different forms, and some that we haven't even thought about, and some maybe we'll hear more about today. Everyone has a role to play, is the bottom line. Parents, teachers, law enforcement, healthcare providers, government officials, business and community leaders, we all have to come together. Behavioral health does not discriminate. It impacts everyone, no matter your gender, race, socioeconomic status, your party classification. This is a bipartisan issue and needs to be approached in such a way. An issue as important as this requires all hands on deck. This is why we are so encouraged by the diversity of industry represented among today's attendees. And I know we have a very, very large group. I don't know how that stacks up against prior participation in summits, but I heard the number was many, many hundreds as of a couple of days ago. So we're just excited to just have such a diverse group. And we look forward to opportunities for further input even after today's summit. Today, we will hear about the challenges, but we will also hear about solutions. And although this is not the ideal platform for idea exchange, we encourage you to complete the survey at the end of today's summit to let us know if you're interested in continued engagement and dialogue. We have an opportunity to make an impactful change in the lives of so many impacted by behavioral health diagnosis. And again, this is not just siloed to behavioral health, but across all healthcare domains. We have an opportunity to make an impact. So let's focus on making that impact. Let's commit to a next normal that breaks silos, that breaks stigma, and breaks the cycle of unnecessary pain and suffering. Let's build a behavioral health system that harnesses the passion, knowledge, and expertise of individuals like you. It's time to get our summit underway today. So following my brief introduction, you'll hear from our opening speakers, Commissioner Allison Land, Delegate Rod Willett, and Senator Emmett in that order. And this is for our opening session. We're thrilled to have you all. The folks I just mentioned, everyone in attendance today, again, thank you so much. And I apologize. I'm in the Hampton Roads area. Jet noise is a thing that we kind of take for granted as a regular part of life. So if you hear some of that in the background, I do apologize for that. Now moving along, Commissioner Allison Land was appointed by Governor Ralph Northam in 2019 to serve as Commissioner of the Virginia Department of Behavioral Health and Developmental Services. Prior to her appointment, she served as the Vice President of Behavioral Health Services for Centera Healthcare. Commissioner Land is a fellow of the American College of Healthcare Executives and has served on numerous committees and boards, including being the former chair of the Behavioral Health Committee. So Commissioner Land, perhaps you can at some point amidst all of your excessive free time, maybe provide some pointers for me in that regard in my occupation in that space, relatively being new. Just as an aside, Commissioner Land and I kind of have a little bit of history from another state in terms of some folks in common and healthcare systems in common before she arrived here, even in Virginia. So just goes to show that healthcare and behavioral health is a small world, not just within our regions, the Commonwealth, but even beyond that. So very special time to have Commissioner Land with us today. We look forward so much to your remarks, and thank you again for your participation. Commissioner?
Good morning. Thank you, Kurt, and just so glad to be here with you this morning. And as Kurt shared, the last year and a half has really challenged Virginia's behavioral health system like no other. And it's safe to say that COVID-19's long-term impact on our system is already being felt. It has also shown the very precarious nature of our state hospitals and of the community behavioral health system as well. And this is happening at a time when Virginians really need us more than ever for their behavioral health. Because of the pandemic, Virginians are now more at risk of depression, anxiety, and substance misuse. These are trends we will no doubt be seeing the effect of for years to come, and they are ones I know we are all monitoring closely, regardless of where our part of the system is. At the same time, Virginia's state hospitals have continued to operate while dealing with historic staffing challenges. And the rising threat of these staffing challenges, and I know Kurt talked about that as well, it's workforce has to be our priority. This poses really a threat to the safety of both patients and staff. And so I was actually had to make the difficult decision over the summer to temporarily halt civil TDO admissions at 5 of our state hospitals until we were able to achieve safer staffing levels. And I just want to take the time, I know there are a lot of folks on here today that have really been great partners with us and supported us in our state hospitals over the last couple of months as we've worked through these challenges. And I'm happy to report that we have been able to reopen all of our facilities to civil TDO admissions. And in fact, as of tomorrow and then next Friday, we'll be even incrementally opening more beds at 2 of them because we've been able to actually do some recruitment. So I'm hoping that that's going to help our stakeholders, like our law enforcement and our private facilities and their EDs that are where patients are boarding, waiting for beds. Our ability to come together like this is so critical to making our system the best it can be for the individuals we serve, especially on a statewide level. And it's important that we have as many voices and perspectives at the table as possible. I know many of you have participated in various work groups over the last year that have been aimed at addressing some of our most pressing issues, like the ED boarding wait times. We continue to be very interested here at the department in expanding contracts to help divert TDO admissions from the state hospitals, and that could be for children, adults, or geriatric patients. and to identify step-down units to help facilitate appropriate and timely discharges from the state hospitals. We're always looking for new ways to partner, so please, please, please do not hesitate to reach out to us. If you have an idea, we want to hear about it. And finally, as we're all working together to take care of Virginians during this busy and ever-changing time, I hope you are taking time out to take care of yourselves as well. It's really important if we're going to continue to be able to give our best to our patients and the individuals in our communities. So thank you again for your partnership and the important work that you're doing. We remain committed here at the agency to working hand in hand with you as we face this new next normal and beyond. Wishing you all good health and happiness as we close out this year, and here's to an even brighter 2022. Thank you. And now I'm going to hand it off to Delegate Rodney Willett to help welcome you as well. Thank you.
Thank you. Thank you, Allison. And it is absolutely an honor to be with all of you this morning virtually. I know we're still doing things that way, but it's a great group gathered today. So many providers, so many stakeholders. We have education institutions represented here, the spectrum. And it takes a spectrum to folks to address these issues that then impact so many Virginians. You may know I chair in the House of Delegates the Behavioral Health Subcommittee. I'm a freshman delegate, but was appointed that because I have a real passion for this issue. And in my experience, unfortunately, is not atypical. Having family members affected with these issues, you don't have to look far to find other people with the same impacts. And certainly, COVID has exacerbated those impacts. We held, as a subcommittee, held hearings on the COVID impact on behavioral health this summer, particularly focused on what you're hearing about already, workforce. There were workforce issues in this area before COVID. They've gotten worse with COVID. And we're really trying to dive into how to address that, how to attract folks into these professions, and we have many providers on the call today, but also how to retain people. And I think that's actually been one of the biggest challenges during COVID is the retention. So much burnout because of just the overwhelming stress on our providers, and just look no further than our state institutions, as Commissioner Land was mentioning. The huge impact there and loss of workers, and we're clawing our way back and with those numbers now, trying to get more people back there, but it's certainly been a concern. So workforce is an issue. I'm also particularly concerned about adolescent mental health. Big issue before COVID. It's gotten much worse during COVID. I've met with parents, school administrators, teachers, mental health providers, pediatricians in particular, and they're all saying the same thing. The levels of anxiety and depression with our students have spiked during COVID. Now they're back in school. And with that, yes, it's great to have them back in school, but that brings more challenges. And so we were able to increase this past session the funding for more school counselors. School counselors cannot solve all these issues, but they are very frontline, and hopefully at least can identify those students who need more help, need the professionals like those of you who are on the call today, and to get them help. But of course, we need more professionals too. We've also increased funding for a program called VMAP. This is helping pediatricians to be frontline providers. Again, they cannot be a substitute for those of you who are the professionals, but they can do triage and get their particularly adolescent patients headed in a better direction, particularly dealing with anxiety and depression. So we're definitely encouraging that. But I will tell you, I am optimistic for one reason in dealing with this crisis, and that is that I believe we are getting past the stigma of even talking about these issues. Yes, today we're amongst professionals who deal with these issues every day, but I'll tell you, in the legislature, there certainly was a time where these issues were, let's say, hushed up, or just not discussed at the same level. Now they're front and center. I was with the Behavioral Health Commission yesterday, hearing testimony there. We're going to stay on the case on these issues. These are front burner issues, and they're not going to be hidden anymore. So That's one step in the right direction, but obviously we need to do more. And the second thing that gives me hope is that we're bringing everyone to the table. Yes, we do operate state facilities and we have to keep the lights on there and get our staffing back. But we absolutely have to have all of you at the table. That's the community service boards, that's the private providers of all levels across the Commonwealth. It's absolutely critical that we have you providing, and we're going to try to do more to encourage that with reforms that Commissioner Land talked about. Last thing I'll mention is the other just really concerning issue during COVID has been the spike in addiction and particularly deaths from addiction. I'm here in Henrico County, the 73rd House District. The Richmond area has had the highest number of deaths from overdoses in the last year. Very troubling numbers. The state as a whole up over 40% in terms of addiction deaths. These are very troubling numbers. We have put money to help bolster the efforts of recovery centers, trying to meet the people where they are. So much more to be done there. You are all part of that solution, and it really is an opportunity. We can look at this as a crisis, or we can look at this as the beginning of a solution. And I think we're at that beginning of a solution, and I'm really, really looking forward to working with all of you. And again, wish you the best for a great conference today. These are the dialogues we need to be having. With that, I think I'm handing it off to my colleague, Senator Emmett Hanger. We were actually together yesterday for that Behavioral Health Commission meeting, and I know he's been passionate on these issues for many years.
Well, good morning, everyone. I'm very pleased to have the opportunity to be a part of the welcoming here this morning, and excited really that so many of you have chosen to join this conference. I understand it's a very large group, and that's a good sign because it's an area that is going to take a lot of hands on deck for us to deal with the problems that we're being confronted with in our behavioral health system. You know, and I will share, I'm not good in the virtual format, not terribly good in person, but in person I can kind of get a sense of what people are interested in, whether they're falling asleep or not, kind of perk it up. But any rate, we're all stressed these days, and I'm stressed a bit this morning. You're sitting there in front of your computer probably with a cup of coffee. I was well prepared this morning. I thought we had some heavy rains last night. I came in late, came here this morning. My office in Mount Solon is in a house that I'm restoring. And I came here, unfortunately, without a key this morning. So the big problem with that, I'm out on the porch, and it's a nice environment here, but the coffee pot's inside and I can't get to it. So, you know, I'm stressed like the rest of everybody else in the world is these days. And that's something we're going to have to address overall in terms of what we're confronted with, the environment for behavioral health. Been involved with our system in Virginia as in the state Senate for quite some time now, going back about 20 years. Indeed, I was involved with Senator Garland when in the aftermath of the Olmstead decision, where we in Virginia, because of that decision and because it was the right thing to do, began a process of downsizing state facilities, our mental health facilities and our training centers, so that we could provide better care for the individuals in need of those services. Well, you know, looking back at that point in time, and I'll use our training centers as an example, we had literally thousands of individuals in our training centers. We had thousands of employees in our training centers. And I had the opportunity to co-chair a joint task force that basically oversaw, and we're still in the process of getting final approvals on that, the downsizing and the transition to community-based services. But we've had this problem of keeping our foot in one place and trying to move to another direction. We've talked about bridge funding that was necessary, and we really have not gotten completely there. But in terms of our training centers, it's a success story because we now have only 75 state beds. Now, the problem with that, of course, we've placed a lot of the burden in community-based services and our CSBs that have issues of their own in terms of funding streams and employment. So we're doing that. Rodney mentioned our new commission on behavioral health. And there's a lot of talk nowadays, well, we've got a broken system here in Virginia. I prefer to think that we still have
Emmett, we have muted you somehow. We need you back on. Emmett, you are still muted.
I'm muted now.
Something jumped in the tech, so apologies for the last 30 seconds or so. Your audience hasn't been able to hear you.
Oh, that was probably a good thing. Any rate, what I was saying the last 30 seconds, there was some actually background noise because I'm outdoors and I'm in a farming community, and the milk truck went through, and I think a tractor went through, and you're liable to hear a horse and buggy go through because I'm in an old order Mennonite area. But I was talking about stress. We need partnerships. We acquired from the private sector Commissioner Land. She's doing a great job. She's a quick study, but she's confronted with a big task at hand. And you know, talking about farming, it's tough to plow new ground. And we've just had some heavy rains. It's tough to plow new ground when you're busy repairing the damage that the floodwaters did to the crop that was already growing. So that's where we're at right now. We can't just stop with what we're doing. We've got to transition. Fortunately, we have some additional funds that are available to us. We're appropriating some of those funds this year, and hopefully we will be able during this upcoming session to prioritize some additional funding. We've got some pilot programs, and Jennifer that from the association has worked with us on getting those programs in place. I want to put more money in those pilot programs and other programs because those types of cooperative programs have proved highly successful. And in that, one closing comment on my part, and let you get on with your conference here. We need partnerships. In Richmond, sometimes we talk about it's us and it's them. It's us and it's them. It might be the state legislature and local government. It may be our private institution, our public institutions and our private institutions. But we all need to recognize this. We're all us. We're all in this together. So we have to cooperatively work and come up with solutions that work. Funding is critical. And I will admit that we've not adequately funded the transition to community-based services. We're going to have to do better at that. But I'm excited that so many of you all are ready and up for the task. You need to prod us, those of us that have legislative responsibilities to adopt policies and adequate funding to make things happen. So I look forward to working with you all. And I hope you have a very successful rest of this day in your conference. And for me, it's about time for my 10 o'clock coffee break, which may be literal today. I might have to break the door down to get into the coffee pot. Thank you all very much. I'll turn it back over to Kurt.
Thank you so much, Senator. And I would break a door down to get some coffee for sure, especially in high need moments. Thank you to all our distinguished guests, the Senator, Delegate Willett, Commissioner Land, for your comments, participation. We're a little bit behind schedule, so we will move on to our keynote, which is next up. I'm going to say now at 10 o'clock, which is just in just a moment's time. So for those attending that, if you can move over in that direction, and we look very much forward to that and the rest of today's agenda. Thank you all.